afternoon, everyone. My name is Nicole Vicordero. I'm your student nurse for today. I'm here to demo on how you will manage if you have a patient who is suffering shoulder dystocia. Shoulder dystocia is a birth problem that is increasing the incidence because the weight, therefore the size of the newborn is increasing. Also, it is appropriate to cure in women with diabetes, in multiparous and post-date pregnancies. In shoulder dystocia, we have two mnemonics. It is the helper mnemonic and the alarmer mnemonic. In helper mnemonic, all maneuvers able to be performed by emergency physician, generally from least to most invasive. In alarmer mnemonic, is an alternative to the helper mnemonic and provides a slightly altered sequence of interventions. The helper mnemonic, H stands for help, E for evaluate for possible episiotomy to increase the anteposterior diameter of passage. L for legs flex, P for pressure, it is the suprapubic pressure. E for the entry maneuvers. R for remove the posterior arm by sweeping it across the chest and bring fetal hand to the chin, grasp and pull out of the birth and across the face. The last R is for the roll on all four arms. It is called the Gaskin position. In alarmer mnemonic, A stands for ask for help, L for legs to chest, A for anterior shoulder disimpaction by suprapubic pressure, R for release posterior shoulder, M for maneuver of Wood, E for episiotomy, and R for roll on all fours. First of all, we need to gather all the equipment needed for internal examination. It is for easy accessibility for the inspection of the external genitalia, vagina, and the cervix. Good afternoon, ma'am. I'm Nicole Vicordero. I'm your student nurse for today. Can you state your name, your age, and your birthday, please? Oh, that's good. How are you feeling today, ma'am? That's fine. I will do internal examination wherein I put my two gloved fingers on your vagina to assess the progress of your labor. Is it okay with you, ma'am? Oh, that's great. Ma'am, you will be positioned on the examination table to assess the progress of your labor. We have three positions here. The first one is the dorsal recumbent. The second one is the Sims position. And the third one is the Nietzsche's position. The aforementioned positions are made best so to expose the gynecologic area to be examined. Positions depends on the client's capability and the examiner's preferred position. Ma'am, I will put a drape on you for your privacy and I will expose the part that I only need to assess. Are you comfortable with your position, ma'am? I will do hand washing and put on the examination gloves in order to assess the client's progress of the labor. It is to protect the healthcare provider from contacting gynecological diseases caused by highly infective organisms. I will notify healthcare providers to assist during the emergency delivery and neonatal resuscitation. McRobert's maneuver is done by grasping the mother's posterior thighs and flexing them against her abdomen. I will instruct the mother to grasp her posterior thigh and flex them against her abdomen. Can you hold this, ma'am? McRobert's maneuver straightens sacrum and decreases angle incline of symphysis pubis and dislodges the impacted shoulder. Shoulder dystocia is often resolved by this maneuver alone. Mazanti maneuver is done by applying pressure on the suprapubic region is done to dislodge anterior shoulder and simultaneously instructing the client to bear down while I apply suprapubic pressure downward with palm or fist, 30 seconds of continuous pressure. In combination with the McRoberts maneuver, this will deliver the baby in 91% of cases. It is useful to understand the lay of the baby, so apply pressure from the correct side and be most effective. It is also useful to have a stool in delivery area to facilitate this maneuver. It is important to observe the woman when performing the suprapubic pressure. Fundal pressure alone is to be avoided because of the potential neurological complications. Rubin maneuver or reverse wood screw maneuver is done with inserting my fingers behind the posterior aspect of the anterior shoulder and rotate the shoulder toward fetal chest. I'll insert my fingers behind the posterior aspect of the armpit of the fetus, then I will rotate the shoulder towards the fetal chest. This maneuver attempts to position the shoulder to utilize the smallest possible diameter of the fetus through the largest diameter of the woman. It is done by applying pressure to the anterior aspect of the posterior shoulder, and an attempt is made to rotate the posterior shoulder to the anterior position. Word screw maneuver is a screw-like maneuver. Success of this maneuver allows easy delivery of the shoulder once the pass of the symphysis pubis. In practice, the anterior disinfection maneuver and Wood's maneuver may be done simultaneously and repetitively to achieve disinfection of the anterior shoulder. Delivering the posterior arm is done by applying the pressure intravaginally at the antecubital fossa, which causes fetal arm to flex, and I will grasp it and sweep across the chest and towards the opposite side of the fetal face. This may be lead to Gaskin maneuver is done by assisting the client to roll onto hands and knees, and I will apply downward tractions or pull downward to deliver the posterior shoulder that can be repeated until the shoulder of the fetus is delivered. Gasket maneuver, moving the woman to all fours, appears to increase the effective pelvic dimensions, allowing the fetal position to shift. This may be disimpacted the shoulder with gentle toward pressure on the posterior shoulder. The anterior shoulder may become more impacted with gravity, but will facilitate the freeing up of the posterior shoulder. Also, this position may be allow easier access to posterior shoulder for rotational maneuvers or removal of the posterior arm. Prior experiment with delivery in this position is an asset. This will be the procedure of the Gaskins maneuver. Baby girl out, 5:45 p.m. If the baby is crying, I will proceed with EINC, and if it is not, I will resuscitate the baby. After the delivery, I will assess the baby's more reflex and check for fractured clavicle or humerus for possible injury. After the delivery of the placenta, I will check for cotyledons if it is complete, and I will check the perineum and the vagina for laceration. I will remove my gloves after I wash the instrument, and after that, I will wash my hands. And before it ends, document all you do in the procedure. It is for legal purposes. That would be all. Thank you.